Do you know how crucial blood pressure monitoring is for your health? Blood pressure is one of the most important indicators of your overall health, especially heart health. Important note: this video is educational only and cannot replace medical consultation. In this video, I'll guide you step by step on getting accurate readings with a digital blood pressure machine. Think of your blood vessels as pipes and your heart as a pump. The pressure tells you how hard your heart is working to push blood through your body. For seniors, this becomes even more important because blood vessels naturally stiffen with age. Heart conditions become more common. Medications may affect blood pressure, and high or low blood pressure can lead to serious problems. Measuring your blood pressure at home isn't just a suggestion. It's one of the best ways to catch problems early, adjust medications, and give your doctor valuable information. Digital blood pressure monitors today are very easy to use. The hardest part is simply understanding what the screen is telling you. But don't worry, we're going to make that extremely simple. Let's start by understanding how these machines work. They measure your blood pressure using two main numbers: systolic and diastolic. Systolic is the top number, and it shows the pressure when your heart beats. Diastolic is the bottom number, indicating the pressure when your heart rests between beats. Together, they help us understand your heart's health. What do the numbers on the screen mean? A typical digital blood pressure machine displays three key numbers: systolic pressure, diastolic pressure, pulse, or heart rate. Let's break them down one by one. 1. Systolic pressure, the top number. This number is usually the largest one displayed. It tells you how much pressure your blood is exerting on your artery walls when your heart beats. Think of it as the pumping pressure here. For example, if the screen shows 140, that means 140 millimeters of mercury, mmHg, of pressure when the heart squeezes. 2. Diastolic pressure, the bottom number. This is the smaller number. It represents the pressure in your arteries when the heart relaxes between beats. So, if you see 80, that's 80 mmHg when the heart is resting. 3. Pulse or heart rate. This number shows how many times your heart beats per minute. For example, pulse 72 means your heart is beating 72 times each minute. Quick recap. Using an example, if your machine shows 140, 80, pulse 72, here's what you're seeing: 140, systolic, heart beating, 80, diastolic, heart resting, 72, heart rate. Before we move on, let's talk about what's considered normal or concerning. Important note: these ranges are general guidelines. Every senior's target range may differ depending on their doctor's recommendations. Typical blood pressure ranges for adults. A normal blood pressure is below 120/80. Elevated blood pressure means the systolic number is between 120/109, while the diastolic stays below 80. Stage 1 hypertension is when readings fall between 130/139 systolic or 80/89 diastolic. Stage 2 hypertension starts at 140 systolic or 90 diastolic and above. A hypertensive crisis, which is a medical emergency, is when systolic reaches 180 or higher, or diastolic reaches 120 or higher. For many seniors, doctors sometimes accept slightly higher numbers. For example, systolic readings in the 130/140 range, depending on health conditions, medications, or risks of dizziness and falls. Always follow your own healthcare provider's advice. That's it. It's actually very simple once you know what each number represents. Next, let's review how to use the machine correctly. First, find a quiet space and sit comfortably. Roll up your sleeve and place the cuff on your bare upper arm. Make sure it's snug, but not too tight. Now, press the start button. The machine will inflate the cuff and then slowly deflate it, giving you your blood pressure and heart rate readings. While using the machine, avoid common mistakes that could affect your readings. Don't talk or move while taking a measurement. Always take measurements at the same time each day for consistency. So, what do good blood pressure ranges look like for adults? Normal blood pressure is typically around 120/80 mmHg. If your readings are consistently higher, it may indicate hypertension, while lower readings could suggest hypotension. Now let's talk about the part that matters most: how to measure blood pressure correctly. Even the best digital machine will give inaccurate numbers if it's used incorrectly. So here's a very simple, senior-friendly checklist. 1. Prepare your body properly for 5 minutes before measuring. Sit down and relax. Don't talk. Don't cross your legs. Keep your feet flat on the floor. Rest your arm on a table. Empty your bladder if needed. Avoid measuring right after walking or doing chores, drinking caffeine, eating a heavy meal, feeling stressed, taking a hot shower. These can all temporarily raise or lower your readings. 2. Position your arm correctly. Your arm should be at heart level. Rest your elbow on a table or armrest. Keep your palm facing upward. Relax. Don't tense the arm. 3. Place the cuff correctly. Whether you use an upper arm machine or a wrist one, placement matters. If it's an upper arm cuff, slide it onto your arm about 1 inch above the elbow. Make sure the tube is on the inner side of your arm. It should be snug, but not painfully tight. If it's a wrist monitor, place it on your wrist according to the instructions. Hold your wrist at heart level. This is the biggest mistake people make. If the wrist is too low or too high, the reading becomes inaccurate. Start the machine properly. Press the start button and relax. Do not talk, do not move, do not cough or laugh. Breathe normally. The cuff will inflate, squeeze your arm, and then slowly deflate while measuring your blood pressure. 5. Read the results carefully. Once the cuff stops and the numbers appear, you will typically see large top number, systolic smaller bottom number, diastolic smaller number with a heart icon, pulse. 6. Record the reading accurately. This is extremely important for seniors. Write down the date, the time, the systolic and diastolic values, your pulse. Any notes? Eat after breakfast. Feeling dizzy. Missed medication. This gives doctors a clear picture of your daily blood pressure patterns. Finally, keeping a simple tracking habit can help monitor any changes over time. Note your readings in a notebook or an app and share them with your healthcare provider during visits. Let's go through the biggest errors that lead to incorrect or misleading readings. Mistake number 1. Talking during measurement. Even short conversations can increase the systolic pressure by 10 to 15 points. Mistake number 2. Poor arm position. If the arm is too low, reading too high. If the arm is too high, reading too low. Mistake number 3. Using the wrong cuff size. A cuff that's too small gives artificially high readings. A cuff that's too large gives artificially low readings. Mistake number 4. Measuring right after activity. Walking from the kitchen to your chair may be enough to elevate your reading temporarily. Wait 5 minutes in a calm, seated position. Mistake number 5. Using a wrist monitor incorrectly. Wrist monitors are convenient but sensitive to positioning. Mistake 6. Taking just one reading. Blood pressure fluctuates naturally. A single reading might be unusually high or low. Taking 2 readings 1 minute apart gives better information. Understanding irregular heartbeat symbols. Many digital monitors today also show special symbols. Irregular heartbeat indicator. If your machine shows a blinking heart or an irregular beat symbol, it means the device detected uneven heart rhythms. This does not always mean a medical emergency, but it is a sign to take a second reading. Monitor regularly. Inform your doctor, especially if it appears frequently. It can happen due to anxiety, deep breathing, moving, or actual heart rhythm issues like atrial fibrillation. Only a doctor can make that determination. When should you be concerned? Seek medical help urgently if you get systolic 180 or higher, diastolic 120 or higher readings. This high could signal a hypertensive crisis. If you also have symptoms like chest pain, shortness of breath, severe headache, weakness, or numbness, vision changes, confusion, call emergency services right away. Otherwise, call your doctor in the case of repeated readings consistently above 140, 90, readings significantly higher or lower than your normal, feeling dizzy, lightheaded, or faint, swelling in ankles, or rapid heartbeat. New symptoms after medication changes. Building a simple BP tracking habit. Consistency is more important than perfection. Here's a recommended routine for seniors. Measure at the same times daily. Ideally, record each reading in a notebook or phone app. Once in the morning, before breakfast and medication, bring the record to your doctor every visit. This helps doctors understand patterns such as white coat, hypertension, morning spikes, medication, side effects, stress, or sleep-related changes. Tracking blood pressure at home is one of the most empowering health habits seniors can adopt. Whether you're a senior yourself, assisting an elderly parent, or working as a caregiver, understanding blood pressure monitoring is vital. Start checking your blood pressure regularly and empower yourself with knowledge. If you found this video helpful, please share it with friends or family who may benefit. Don't forget to like and subscribe for more health tips.